Artificial intelligence has entered medicine, and it's not knocking at the door anymore. It's inside the hospital, inside the clinic, inside the lab, and soon, inside every decision we make about health and disease. From diagnosing cancer to predicting heart attacks before they happen, AI is moving faster than any medical technology in human history. But with this power comes fear, disruption, and an uncomfortable question. Is AI taking over medicine? And if so, who should be worried the most? AI systems today can read X-rays, CT scans, MRIs, and pathology slides with accuracy that often equals or exceeds human specialists. Dermatology? AI can detect skin cancer from a smartphone photo. Ophthalmology? AI screens diabetic retinopathy in minutes. Cardiology? AI interprets ECGs, echoes, and predicts arrhythmia before symptoms appear. Scene: AI highlighting abnormalities in transparent overlays, but that's only the beginning. AI now handles medical records, billing, triage, scheduling, and insurance approvals, tasks that drain 30–40% of a doctor's time. Scene: virtual assistants managing appointments. Robotic surgery is becoming semi-autonomous. AI can assist in laparoscopic navigation, stabilize hand tremor, and map out tumor boundaries in real time. Scene: Da Vinci-style surgery robots. Before AI, discovering a new drug took 10–15 years. Today, AI is generating new molecules in hours and predicting which will work. Scene: 3D molecular animations. AI models now forecast who will develop diabetes, kidney failure, stroke, or mental health crises, sometimes years before the first symptoms. Let's not pretend AI will replace thousands of tasks that medical professionals do today. Radiologists, pathologists, pharmacists, administrators, even specialists will feel the pressure. AI is only as good as the data it's trained on. If the data is biased, the decisions will be biased. Underrepresented groups, Africans, women, the poor, risk being misdiagnosed, underdiagnosed, or ignored. AI can track your heart rate, sleep, blood pressure, glucose, fertility cycles, movement, everything. This opens the door to the darkest scenarios: insurance discrimination, government surveillance, and corporate control over personal health data. If clinicians depend too heavily on AI, critical thinking weakens. Medicine becomes click to diagnose, and the human touch evaporates. The AI and medicine industry is dominated by a handful of giant corporations controlling algorithms, data, and medical decision-making. If they fail or manipulate the system, the consequences are enormous. Imaging and microscopy are the lowest hanging fruit for AI. These fields will transform from image readers to AI supervisors. AI is automating drug dispensing, drug interaction checks, and medication counseling. Billing, coding, scheduling, triage. AI does all of this faster and cleaner. Training for careers that may not exist in 10 years is a real risk. Students must pivot toward AI-augmented medicine, not the traditional model. Africa, Asia, and Latin America risk digital colonization. If medical data leaves the continent, we lose control over our future health systems. Clinical professionals must evolve. Learn AI literacy, data science basics, interpretation of AI outputs, bioinformatics, ethics oversight. Scene: doctors using tablets, reviewing AI dashboards. Empathy, clinical judgment, ethics, patient connection, communication. These will define the doctors who remain relevant. Africa must develop its own datasets, own its algorithms, train local scientists, regulate AI use in diagnostics and therapy. Strong policies are needed to prevent misuse. Data privacy laws, ethical AI audits, standards for clinical AI validation, local data storage, insurance protections, transparency rules. No patient should accept an AI-generated decision blindly. Ask, how accurate is this model? Was it validated on people like me? Who controls this system? AI will not destroy medicine, but it will destroy the version of medicine we used to know. Those who adapt will rise. Those who resist will be replaced. The future of healthcare is not human versus machine. It is human plus machine. And the question is no longer, is AI taking over? The question is, are we ready?